It's been a long time since the federal government had to implement a great big new program. 10 years ago, we saw implementation of Medicare Part D and implementation of the brand new Department of Homeland Security. In each instance, there were substantial growing pains and there were predictions of disaster, as there have been with the Affordable Care Act. In the case of Medicare Part D, implementation exceeded expectations and costs have not been nearly as high as was originally feared. In the case of the Department of Homeland Security, the implementation was bumpier. Nonetheless, 10 years later, both systems operate more or less smoothly, and in retrospect, the crisis looks overblown. This year, the Obama administration needs to finalize implementation of the Affordable Care Act, a historic piece of legislation and the most significant domestic policy achievement of the administration to date. And the question of how it goes is front and center. Even the president has admitted that there will be hiccups along the way. Compared to earlier pieces of health care legislation, this one is incredibly complex, involving activity in 50 states, 50 state insurance commissioners, and large changes in the private healthcare industry. And just to add to that complexity is a Republican Party that still doesn't like it, and in fact on Thursday voted for the 37th time to repeal the act.